Thank you for these great opportunities. Good morning, good afternoon, good evening, everyone. I'm glad to see you here. I'm Mita Restinia. I'm a pharmacist. I'm a lecturer at one of public university in Jakarta, Indonesia, UIN Syarif Hidayatullah, Jakarta. So today, in this great moment, I'd like to talk about one of my research that is a treatment outcome of drug-resistant tuberculosis in Indonesia, 2018 to 2021. And here is my research team. And here is my outline. So today I'm going to talk about the first about introduction, and the second is objective of the study, and the third is going to talk about the research method, and the last one I'm going to talk about the conclusion and the recommendation what I can get from the study. So I'm going to move the next slide. We know that tuberculosis is a communicable disease that is a major cause of ill health and one of the leading causes of the worldwide. And this disease can cause by Mycobacterium tuberculosis. This bacteria is a unique bacteria, so it can be active or latent in your body. Among tuberculosis patients, we can find that the bacteria still sensitive for the antibiotic of first-line antibiotic, for example, Rifampicin, isoniazid, streptomycin, or etc. But some bacteria, I mean Mycobacterium tuberculosis, cannot, resistant for those antibiotic, for example, monoresistant tuberculosis or multidrug-resistant tuberculosis and extensively drug-resistant tuberculosis. So if the bacteria have resistance to those antibiotics, so the treatment will be changed into the second-line antibiotic. For a global burden of tuberculosis, we can see, according to WHO, in 2018, 10 million people feel ill with tuberculosis, and more people reach with quality tuberculosis care. And tuberculosis is the top infection killer in the world. Maybe 1 minute, seconds.
Okay, no worries.
I'm sorry, can I continue my
presentation?
Yeah,
of course. Okay. Please go on.
Thank you. Thank you for the time. So I'm going to continue my speak. So the problem is drug-resistant tuberculosis remains a public health crisis, and unfortunately, only 1 in 3 people have access treatment, and only around 50% were treated successfully. So we can see that the successful rate is still low for a drug-resistant tuberculosis patient. So in Indonesia, we can see here that Indonesia is the second highest number of cases of tuberculosis in the world after India. And the treatment success rate or drug-resistant, rifampicin resistant or multidrug-resistant tuberculosis only 48%. And we have estimated cases around 24,000 in 2020. And we can see the graphic, the blue line, you can see that the blue line show that the successful rate become decline after 2010, and this the default of treatment, the death because of tuberculosis and the fail of treatment become increase. So because of that, we need to analyze what the problem and what the factor affected the unsuccessful treatment. Because of that, my study was conducted to understand the profile of treatment outcome of drug-resistant tuberculosis in Indonesia, and to analyze the correlation of sociodemographic and clinical characteristic to unsuccessful treatment of drug-resistant tuberculosis. And then here is the study method that I can use to this study was conducted by a retrospective cohort study of adult patients with confirmed drug-resistant tuberculosis who were treated from period of a study 2018 until 2020. So we followed the patients retrospectively until the patient get the treatment outcome by the doctor. So the treatment outcome may be a successful or unsuccessful treatment. Then the unsuccessful treatment, we divided into 3 categories that were default, failure, and death. And then we evaluate limited for sociodemographic characteristic and clinical characteristic that influence those parameters to unsuccessful treatment. For this purpose, so we analyze the data, descriptive and statistic. We use bivariate analysis, for example, chi-square. So for the result, the study, we have 136 drug-resistant TB patients enrolled in the study. And among of them, most of the patients were males, and the mean age of more than 49 years. And for clinical characteristic, we can see here from the table that most of kind of drug resistant was rifampicin resistant. That was 93.4% of patients, and then polio resistant in 3.7%, and excessively drug resistant, and then last one multi-drug resistant. So we can see here that most of the patients were rifampicin resistant. So we can see the treatment outcome profile. In my study, only 36% among of the patients successful in treatment. Unfortunately, most of them saw the unsuccessful treatment. So we highlighted the unsuccessful treatment, so we can see here that most of the patient default during the treatment. So the patient cannot continue the treatment, so they become unsuccessful treatment. In analysis bivariate, we can see here that the among of the characteristic, sociodemographic characteristic, and then the clinical characteristic patient. So we highlighted that the affect significantly to the unsuccessful treatment. So I only saw the the significant influence to unsuccessful treatment. So the first parameter is gender. We can see here male patients showed that 1.306 times more risk to unsuccessful treatment than female. And the p-value is lower than 0.05. And then the second parameter that significant influence, the marital status. Patients with no marital status have risk to unsuccessful treatment about 1.4 times compared with the patient with marital status. We can see here that the successful treatment with marital status is become higher. We can see that marital status can 40% respondent or patient with the marital status will successful in the treatment. And the third parameters, we can see here the correlation of adherence to hospital visit with unsuccessful treatment. We can see here all patients with no adherence to the treatment had poor outcome. Patient with less than 100% adherence to hospital visit, so there were no successful here. So it'll be more concern for a health professional to care about it. And then patient with number of visits less than 100% have risk of unsuccessful treatments 10.8 times compared with patient with 100% adherence to hospital visit. So it's mean the adherence is so important to achieve the successful of treatment among a drug-resistant tuberculosis patient. So the correlation of treatment duration with unsuccessful treatment, we can see here if the patient has diagnosed drug resistance, so it will be two categories of treatment in Indonesia. So we have short duration of treatment and we have long duration of treatment. Short treatment, it's about 9 to 12 months for the treatment, and the long treatment, it's mean the patient will be treated about 18 to 24 months. So we can see here the rate of successful of treatment become higher in the short duration of treatment compared with the long treatment. Patients with long treatment have the risk of unsuccessful treatment 2.1 times compared with short treatments. I think the more duration of treatment, it will become an adherence the patient, because the patient will be bored or will be no adherence to the treatment. So we need to concern about it as well. So for the conclusion and recommendation, so the study highlighted that the treatment successful rate of drug-resistant TB patient in Indonesia was still poor. Male, no marital status, no adherence to the hospital visit, and patient with the long treatment have more risk to unsuccessful treatment. So for the recommendation, I suppose to further improve the treatment outcome, providing special attention, enhanced clinical management, and education should be given to the patient with high risk unsuccessful treatment of drug-resistant tuberculosis patient. So here is the references, and I think that's all my presentation. Thank you.